Ano. Is it recording now?
May nakalimutan ka ba?
Yes, ma'am.
Yes, ma'am. Sige, thank you. Okay, again, so we are now on the cellular entities in microorganism. So these entities are not considered a cell simply because they do not have a machinery of their own, meaning they cannot survive on their own. They need to have the host cell in order to survive and to proliferate. Okay, so the first of the cellular entities are the viruses. So viruses are obligate intracellular parasites. Anong ibig sabihin yan? When you say obligate intracellular parasites, they need to be inside the cell of the host. So they cannot be outside. So in order for them, sabi ko nga, to survive, they have to be inside the cell of the host. And by the term parasites, by the term parasites, so lahat ng mga nutrients and everything, they have to get it from the host. So meaning, wala talaga sila. On their own, they are nothing. So they need the host in order for them to do everything. Then they do not have organelles or ribosomes, unlike the eukaryotic cells and the prokaryotic cells na merong organelles or ribosomes. Excuse me, Jude. Sorry. Then they have a protein coat. No? So, ang basic life form sila is the protein coat na meron sila. And this protein coat contain the glycoprotein kung saan doon ang RNA or DNA na naka-embed. So, the most important thing with the viruses is their genome, either DNA or RNA. So, these are the different family of viruses. So may maka non-envelope and envelope. And then merong DNA and RNA. So if you can see this picture, this is a representation of the sizes, no? Comparison ng sizes from one family to the next family. So if you notice, the largest virus is your belongs to the Paxviridae, your Vaccinia. And then the smallest so far is your Parvoviridae. Okay, so this one. So yan. So this is your coronavirus, the very kanang sikat ngayon, no? Your coronavirus. Later we'll discuss what is that all about. Okay, so let's go to the viral structure. Since sabi natin, a virus is not a cell, but it has a structure. So ano ang meron siya? It has a virion or the virus particle. So yung virus particle, that's the one that will invade the host cell. So in that particle, meron ang kanyang, nandun ang nucleic acid genome packed in a protein coat which we call capsid. So yung genome na yon, it's either a DNA or an RNA. So, and then it is being packed into a capsid. So yun ang pinaka-importante na part ng virus. And then meron din siya mga viral proteins and enzymes inside the virus. But the most important thing is the genome of the virus, which is your DNA or RNA. So a virus will only carry one genome. So either lang, hindi pwedeng dalawa. Okay, let's go to the different DNA viruses. So we will be discussing them according to the family where they belong. So the first one in the DNA are your Hepadnaviridae. So that is the family, no? Hepadnaviridae. Under this virus, under this family, we have the hepatitis virus. So the hepatitis virus is transmitted through blood, through sexual contact, or neonatal. When we say neonatal, from the mother to the fetus. So it is the cause of your hepatitis B. So that's the disease, no? Hepatitis B. Now, the hepatitis B virus lives in all human body fluids. So, kaya nga, all hospital workers should be vaccinated. When you are working in the hospital, if you're a nurse, a doctor, or kahit na midwives, as long as you are in direct contact with your patients, you are required to have a hepatitis virus vaccination. Yung mga interns natin, before they go on hospital internship, they are required they were required, yung mga graduates na natin, they were required to have this vaccination of hepatitis B. No? So requirement yan siya. So during active infection and viral growth, a soluble component of the core is released. So kaya nga, when you will be tested, so that will become the marker, no, for active disease, and if the disease is highly infectious. So that's the way to know. And yung hepatitis B virus ninyo can lead to hepatocellular carcinoma or cancer of the liver. So if it is not tawag nito, if it is not treated, but you know, viral infections have no treatment. So this is what I would like to emphasize. Always remember that viral diseases or infections do not have treatment, unlike your bacterial infections. Nya, mangutana mo, nga naman lagi maayo man ka. It's not really maayo. It's just that the body's immune system was able to control the virus. And there are viruses that are self-limiting. When we say self-limiting, they will only live in the body for 1 week, 2 weeks. Just like your varicella or your chickenpox, no? So self-limiting lang. Pero yung may mga virus talaga na up until the host is alive, they are present. Okay. So your hepatitis B, yun nga, ang complication niya later on, as I've mentioned, is your primary hepatocellular carcinoma. So this is the hepatitis A kasi tayo, which we get from food, but this one we get usually from secretions, from blood or sexual contact. Okay, so that's your hepatitis B virus under the Hepatnaviridae family. Then the next family is the herpes viridae. So ang SHV is herpes zoster, herpes simplex rather, herpes simplex virus 1 and herpes simplex virus 2. So what's the difference between the 1 and 2? Now the 1, you get fever blisters, no? Cold sores. Ang cold sores is the one that, if you know, in local dialect, we call it ugahip. No, I don't know the Tagalog term for that. That is your cold sores. Usually sa lip, sa area sa lips, no? And even sa face na siya. And it can also cause genital lesions and fever blisters. So you get this virus from close contact. So either through saliva, vaginal secretions, or even the vesical fluid. So, ang latency ng herpes viridae is that during the primary infection, so itong dalawang ito, the viruses will migrate to the nerves to the sensory ganglia and reside there. So, they will go to the nerves, to the sensory ganglia and reside. Kung latent na meaning, naayo na ka from the infection, but the virus is still in your system, so they will go there. And sometimes magkakaroon ng reactivation. So if ma-reactivate, they will migrate out from that area and they will go to the peripheral skin via the nerves. Kaya minsan, pag ang imong immunity is not that strong, no, so very dili naman tanan, just a few na nagkakaroon ng reactivation of the viral infection. Now, your herpes simplex virus 2 is the one that is, you get this really from sexual contact, no? So, and close contact. So this is the one that is causing your genital herpes, no? Oral lesions, genital herpes, and neonatal herpes simplex virus. So this one. More, ang kani siya, more on the cold sores. Ang genital herpes is the SHV2. So mo na siya ang difference, but still they are under the same family of herpes viridae. Another important virus under this family is your varicella zoster, which is the causative agent of your chickenpox. So you can get this from respiratory route. So ang transmission niya is through respiratory droplets, ang chickenpox. Now, your varicella zoster virus is highly contagious. So almost 90% of exposed patient, so pwede silang magkaroon ng maging carrier and matransmit ang infection. So may mga vesicles. So vesicle will appear all over the body of the person being infected with this chickenpox, no? So, but as I've mentioned, ang chickenpox naman, superficial lang ang lesions niya. And the lesions are not are at different stages of development, and usually more common siya sa trunk area, no, sa trunk, so the whole body itself. Now, what about shingles? The shingles is the reactivation of your varicella zoster virus. Sabi ko nga, if you are, kunyari, nagkaroon ka ng chickenpox. So, chickenpox, pwede kang walang inumin kasi self-limiting siya, provided it will not have any complication. Or pwede ka rin uminom ng mga acyclovir, that's the drug, no, that we use for viral infection, especially sa chickenpox. Now, if you are treated with that, so naayo ka, after so many years, pwede kang magkaroon ng reactivation of the virus. Di ba sabi ko, ang virus pumunta doon sa nerves, no, migrate to the nerves, to the sensory ganglia, and will reside there. Now, in this instance, it will reactivate. So the reactivation of this varicella zoster is not the same, the first infection na may mga vesicles all over the body, but it's a shingles. So this is just in the trunk, sa tiyan, no? And it will start from one side of sa area ng trunk, sa may bandang tiyan, and then it will, kumbaga, mudagan siya, no, palibot, no? And ang shingles is very painful kasi nga the virus is in the nerves, no? So painful siya compared to the chickenpox. So naalay mga instances no ma-reactivate. So muna nga nung ma-reactivate siya, maybe you have been exposed to a person nga na chickenpox, and during that time, although nagka-chickenpox ka na, your immune system was low, so pwede siya ma-reactivate. So that's the case. You have your Epstein-Barr virus, the EPV. No, your Epstein-Barr is transmitted through oral secretions, close contact, and this is the tawag nito, this is the cause of your Burkitt's lymphoma or infectious mononucleosis, no? So Epstein-Barr virus infects the human beta cells. So transform the cells so it won't follow normal growth control. Okay. Sometimes it can also become latent, no? So and then it will come a time na mag-release din siya, no? But there will be viral release. Okay. Now, your cytomegalovirus, the CVM, can be transmitted through blood, organ transplants. Kasi nga naman, di ba? If the person, the donor, meron siya nito, so the person receiving that organ can also have the virus. So, organ transplants. Transplacental from mother to the fetus during through the placenta, and close contact with secretion. So, you will chronic fatigue syndrome and congenital infection. So, yun ang cause ng cytomegalovirus. Okay. So, those are just the important viruses under your herpes viridae. We go now to adenoviridae. So, under adenoviridae, you have your adenovirus. So, ang adenovirus is transmitted through direct contact via respiratory droplets or through the fecal-oral route. Now, your adenoviridae is the cause of your upper respiratory tract infection. So, it causes upper respiratory tract infections, ang mga adenoviruses. So, among this, you have your pneumonia, your pharyngitis, conjunctivitis, and sometimes gastroenteritis in children. So, ARD is acute respiratory disease. No? Acute respiratory disease muna siya. So all of these are upper respiratory tract infections. The next family is your papillomaviridae. So this is your HPV or the human papillomavirus. So ang human papillomavirus can be transmitted through direct contact. So direct contact. So fomites. So later we will discuss ano yung fomites. So sexual contact. So this is really the most direct contact, no, or sexual contact. So the most common route for this HPV is sexual contact. So it can cause your skin warts. So kung direct contact lang, not the sexual contact, yung skin warts nyo. So yun, di ba? Kanang kalunggo in Bisaya, we call it. Or mucosal papillomas. But if it is transmitted through sexual contact, you will have the anogenital warts. So it is the warts will grow in the anus and the genital areas. Kaya nga anogenital, no? Para siyang cauliflower. So the warts here, parang cauliflower. And then, pag hindi siya na-treat, it can lead to cervical cancer. So this is the reason why, di ba sinasabi, it's better daw mga babae magpa HPV vaccine, no? Human papilloma virus vaccination to protect themselves from having cervical cancer. Now, those who are prone to this one are those with multiple sexual partners. So having sexual contact without protection. So yun sila ang pinaka-prone to having this type of viral infection na cervical, which can lead to cervical cancer. Okay. Why cervical? Because the virus will tawag nito, stay in that area, no, sa cervix. The cervix is the upper from the outside of the genital area sa babae, going through after the vaginal canal, that's the cervix, no? So yan. But there are different strains. Ang daming strains ng papilloma na pwedeng mag-cause ng virus and, mag-cause ng warts and cervical cancer. Okay. Then we have your parvoviridae. Ang parvoviridae ninyo is usually common in animals, di ba? Makadungog mo ang inyong iro ay ipa-parvovirus vaccination. So, but there is a human parvovirus, meaning this is the only human parvovirus. So this is the type of virus under this family that can infect a human being. So your parvovirus B19. So this is transmitted through respiratory droplets or through transplacental. Now, what disease will it cause? It can cause your erythema infectiosum, also known as fifth disease. Now, ano itong fifth disease? So, fifth disease is a mild rash illness caused by this virus. It is common in children than in adults. So a person usually gets sick with the fifth disease within 14 days after getting infected with the virus. Why called na fifth? Because the disease got its name because it was fifth. Ikalima siya in a list of historical classification of common skin rash illnesses in children. Kaya tinawag siya na fifth disease or erythema infectiosum. And it can also lead to fetal anemia, no, ang parvovirus B19. You can ask question along the way if na ideally maano nga. The next family is your Polyomaviridae. So this is under this family, you have your JC virus. JC stands for John Cunningham. So it is John Cunningham virus. So this is transmitted through the respiratory route. And it can cause a progressive multifocal leukoencephalopathy in immunocompromised patients. Now, ano ang virus na ito? So, John Cunningham discovered this in 1971. So, he was a doctor, and then, the virus was first discovered in 1971 when a doctor found it in the brain. So sa brain of a man with Hodgkin's lymphoma, and that doctor was JC or John Cunningham, so he named the virus after him. So this virus naman doesn't cause any problems for most people, but it can be dangerous if you have a weak immune system, kaya nga immunocompromised patients. So there's no known way to keep yourself from getting it. So we do not know na there's really no typical prevention, no? So anybody can get it. So experts do not know how it is spread, but it's thought that many people pick it up as kids through food or water, and then it settles in the urinary tract, bone marrow, tonsils, or the brain of the person. And it can stay there for years. And most people never know that they have it. Now, ang problem lang is, kaya nga, it will lead to leukoencephalopathy in immunocompromised patients. Now, ano yung leukoencephalopathy? So it refers to disorders of the brain white matter. So it's a brains, no, brain white matter. The importance of white matter in the normal function of the central nervous system, lalo na sa motor and sensory system. So yung brain white. So ang mangyayari is that in leukoencephalopathy, there will be vanishing of the white matter. And this is a progressive disorder. So meaning di na to siya mapugnan. So progressive disorder. So it affects the brain and the spinal cord, no, or the central nervous system. So the disorder causes deterioration. So pag nagkaroon yan doon, so deterioration of the CNS, tapos kaya nga later the person suffering from this one, mag-deteriorate ang brain, so wala na, more than not kind of think thoroughly or kanang not in the parang full state of mind, no? Usually pag adults, no? Adults siya. Okay. Then the next family is your Paxviridae. So this is the largest and the most complex of all viruses, yung pinakita ko kanina. But the virus that I've shown you kanina sa picture was a vaccinia. So vaccinia is infects cows, no? The one that infects human being is the variola. And this is the one that causes your smallpox. And this is transmitted through respiratory route. Kaya lang, smallpox is already eradicated. So meaning you can no longer find a person that will be sick of smallpox. So the last case of smallpox was in 1977. And up to now, walang emergence. Kasi nga, this has been eradicated, no? So, kaya lang, all pox infections before are very contagious, no? Contagious siya. And walang treatment. So, better na lang talaga na wala na siya ngayon. I have read in one of the books, but that was a very old book na there is a sample of this virus which has been kept in a laboratory and for for scientific purposes. But the only danger there is that this can be used as a biowarfare, no, for biowarfare. So this can be used. So yun lang. Just like the COVID ngayon, di ba? Ang daming nagsasabi na parang they use it as a biowarfare. So pwedeng mangyari din. Okay? So those are your DNA viruses. So mas konti lang talaga ang viruses that have DNA in their genome. So we go now to the RNA. Ang RNA ninyo naman ang medyo maraming types ng viruses. Okay. So we go to the first RNA virus family, your Paramyxoviridae. So your Paramyxoviridae is we have para-influenza and measles virus, no? Meron din tayong later mumps and So sa para-influenza virus, this is transmitted through respiratory route, droplet aerosols. So the person will feel cold-like illness, so parang meron kang sipon, or bronchitis, inflammation of the bronchial tubes, and this croup. So what is this croup? So this is also known as laryngotracheobronchitis. So it is a type of respiratory infection that is usually that is caused by a virus. So pwede rin siyang kasing cause ng other organism, but the usual cause of this disease is a virus, and this is your para-influenza virus. Now, the infection leads to swelling inside the trachea, so which interferes with normal breathing and produces the classic symptoms of barking cough and a hoarse voice. So paggaw and then barking cough. So that is your clue. Okay, so infection siya ng upper airway. Pwede rin siya kasi nga may swelling, it can obstruct breathing. So maglisod o ginhawa ang patient and causes yung pag-ubo. So the cough and other signs and symptoms are the result of the swelling around the voice box. Kaya tinawag siya laryngo, the windpipe, the trachea, and the bronchial tube. So tatlo ang magkakaroon ng swelling dito sa croup na sakit, no? The larynx, the trachea and the bronchi, kaya nga laryngotracheobronchitis. So that is your para-influenza. Now, your measles naman is a respiratory, transmitted through respiratory droplets. So it can cause your measles o yung tigdas na sinasabi natin, your pneumonitis, and your pneumonia. So, but we have vaccination against measles, no? But there was an outbreak, not really, parang outbreak na rin of measles in the Philippines. I think it's 2 years or 3 years ago. So because of that, di ba ngayon ang mga parents, they are doubtful to have their children vaccinated because of that Dengvaxia, if you recall, no, Dengvaxia. Kaya because of that, nagkaroon ng outbreak ang measles because mothers do not go to the rural health centers or to their doctors to have their children immunized or vaccinated against measles because of that Dengvaxia case. So nag-shoot up ang measles. So this is a very preventable disease through vaccination. Kaya lang minsan ang problema is that when the vaccine itself is not kept in the right manner, kasi you have to refrigerate this one eh. So yun, minsan pag inject sa bata, pwede na yung attenuated vaccine doon is wala na, no, namatay na. So yan ang problema. Now another virus under this family is your mumps virus. So this is your causative agent for mumps, or we call it in Bisaya as bayuok. I don't know how do you call it in Tagalog, no? So the same pa rin, respiratory route infection. And sabi ko nga, we have a vaccine for this, your MMR, so mumps, measles, rubella. The measles vaccine is separate. Meron ding iba yung MMR, mumps, measles, and rubella vaccine. So ang mumps naman, kung hindi ka na-vaccinate, so you can get it, no? The only problem is that if the person getting the mumps is a male, lalaki, and he got the infection during puberty, no, adolescence, during puberty. Now, there can be a, pwede ha, so pwede not all, pwede siyang, kasi kung lalaki during puberty, pwedeng magkaroon ng orchitis. What is orchitis? So orchitis is the inflammation of the testicles. Pwedeng isang testicle or dalawang testicle mag-inflame. So that is the complication of mumps sa mga lalaki during puberty kung magkaroon sila nito. Now, ano ang magiging result? It can affect the fertility of the individual. So pwedeng magiging sterile na, kumbaga not capable of bearing children, no? But that is a very small percentage. Kaya lang kung matimingan, malas naman, parang ganon. So kaya nga, very, very important ito siya sa mga lalaki talaga, no, na i-vaccinate against these mumps. And this respiratory syncytial virus, so the same respiratory droplets, it can cause pneumonia in infants, the bronchiolitis, and the common colds in adults. Next to this one is your orthomyxoviridae. Okay. So your orthomyxoviridae is your influenza viruses A, B, C, and D. So ang influenza, ang dami niya, may A, B, C, and D. So this is the cause of the classic flu, no? So, di ba, common masyado ang flu during the June, July season. So, and sometimes pwede ring respiratory tract infection. But noon, if you have flu, if you have your cough, cold, runny nose, fever, and everything, we are not, sasabihin lang natin, it's just a flu, no? But today, if you feel something, makuyawan na ka because of the coronavirus, no? Kasi ang kanyang representation is flu-like symptoms din siya. Okay. So I think if flu naman, wala kasing treatment, as I've mentioned, the viral disease. So you really have to boost the immune system, and then the treatment is we treat the symptom. Symptomatic ang treatment. So kung ano yung symptom, yung ang ginatreat natin sa ganitong uri ng infection. Okay. Then we have the Arenaviridae. So this virus is the cause of your Lassa fever and Machupo viruses. So zoonosis siya. So meaning we get it from inhalation of the rodent aerosol. So naa siya rodent involved. So ano itong Lassa fever? So Lassa fever is an acute hemorrhagic illness. Okay. So humans become infected with the Lassa virus through exposure to food or household items contaminated with the urine or feces of the rodent, especially rats. No? So the disease is endemic in the rodent population, but not in the Philippines, in West Africa. Okay, so at least wala siya diri sa atua. The Machupo naman is spread through aerosolized, foodborne, or direct contact of the virus particles. Now, these particles result from the saliva, urine, or feces of mouse. Ang reservoir niya is mouse, no? So, the virus spread most effectively when the dried mouse urine on the dirt floors, so kanong nasa mga salog of homes, was swept into the air during cleaning and inhaled by inhabitants of the home. Kaya nga, it is usually a precaution when you clean, tapos, di ba, kung abog and mag-sweep ka, you have to wear your mask. Di ba? Kasi, you do not know. Wala lagi na diha, waka kabalo na diha ang ilaga, nalibang, di ba? Or, so, pwede nimo siyang ma-inhale. So, that's the transmission. Kaya, I think the wearing of the mask will become a very new normal, no? Dili lang sa ingon ana, but kahit sa balay, no? Manghinlo ka. Okay. So that's your Lassa fever and Machupo viruses. Then we have the Rhabdoviridae or rabies virus, very, very common. So usually people is infected with this one if they are bitten by an animal who has the virus. And usually common in the Philippines are the dogs, especially mga stray dogs, mga askal stray dogs, asong kalye, no? So katong walay tag-iya. Now, kung ang iro naman nimo, if your dog is na lang sa balay and then wala siya contact with other dogs outside, probability dili jud siya magka-virus. But sometimes one dog can get it from another dog, no? Ang rabies virus. So ang saliva of that animal, so kung paakon ka, syempre naman dyan ay saliva, if na dito ang virus, probability is that you will have the infection. Now, the rabies virus has to travel, no? So after you are bitten, the virus will travel through the body to the brain. Ang iyang target niya is the brain, no? Before it can cause symptoms. Kaya nga, if you are bitten sa tiil, layo pa siyang i-travel. But if you are bitten like malapit sa ulo, so that's the shorter ang time for the travel of the virus. So this time between the exposure and the appearance of symptoms, that is the incubation period. And it may last for weeks to months. Remember the incubation of the rabies virus can last from weeks to months. So depende kung asa ka napaakan. Kung sa tiil, layo pa man kayo na siya sa ulo, so it may take months. Naaga ni mga instances na it will take years. Okay, so before siya mag-manifest dito sa individual. So the first symptoms of rabies is very similar to those of the flu. So general weakness or discomfort, na ay fever, na ay headache, and these symptoms can last for days. Now, sinasabi natin, if napaakan kang iro, di ba, we cannot diagnose na, naa kay rabies. Usually, ang dog is isolate, para bang i-isolate siya and observe. Dili mo pwede patcho ng iro. So, the dog will be observed for 14 days. If the dog dies within the 14 days, mamatay ang iro, dako ang chance na nakatransmit siya virus dito sa napaakan. So if you are bitten by a dog, we do not wait for the 14 days or we do not wait when the dog will die. We will give the virus to the individual na napaakan. Now, how to establish talaga if namatay ang iro, like karon ka napaakan, namatay pagkaugma. So, kuyawan na kay 1 day lang. So, how to really diagnose is that kay namatay man ang iro, we can get a sample tissue of the dog's brain. So we get a tissue from the dog's brain. Then we do a laboratory testing on that. And then if we see negri bodies on that brain tissue of that dog, then we can conclude that that dog is a rabid dog and dako jud ang chance na ang iyang napaakan is na tagaan og rabies na sakit. So that's the way to know, no, to really conclude, no, lalo na pag namatay kaagad yung aso. So you get a section of the brain and then you do the testing, you look for the negri bodies. So we call it the negri bodies, that's your rabies infection. Now also remember that if other viral infections, meron siyang vaccination, the rabies do not have. Dili ka pwede tagaan og rabies vaccination. Kay para kung mapaakan ka sa iro or anything, dili ka magka-rabies, walay ingon ana. Pwede siya sa iro or sa mga pets nimo i-vaccinate siya against rabies. But humans cannot be vaccinated with rabies, no? Tagaan lang jud ka sa rabies virus kung napaakan ka. So that's the protocol ha. Dili pwede na injeksyonan ka daan kay kung mapaakan ka, kuan ka nang safe ka. So hindi ganyan ang rabies. So you remember that. Then we have the Filoviridae family. So this is your Ebola and the Marburg viruses. So you can get it from direct contact with the infected blood or secretions of the person, and it can cause hemorrhagic fever. Now, years ago, there was an outbreak of Ebola, and even now, meron nga outbreak daw, no, ng Ebola. So what is Ebola? Yung Ebola virus disease, so that is the disease that is caused, is a rare and deadly disease in people and even non-human primates. So usually this is located in sub-Saharan Africa. So wala sa Philippines, no. People can get the Ebola virus disease through direct contact with an infected animal, usually bat or non-human primate, or a sick or dead person with infected. So dili lang limo mo kasi sa animal, pwede rin sa tao, no. Now the symptoms of the disease will appear from the second day to the 21, so from 2 to 21 days, from day 2 to day 21 days after contact with the virus, with an average of 8 to 10 days. So usually ang symptoms will show on from 8 to 10 days average, but for other people it may take longer. So the course of the illness is typically progresses from dry symptoms. So ano yung mga dry symptoms? Meron kang fever, may aches and pains, and fatigue. And later, it will progress to the wet symptoms. So ang wet symptoms, doon na magkaroon ng diarrhea and vomiting. And the person becomes sicker. So from dry to wet, the person becomes sicker. Okay. Now, primary signs and symptoms of Ebola include fever, aches and pains like headache, muscle and joint pain, abdominal pain, weakness and fatigue, GIT symptoms that would include diarrhea, vomiting, abdominal pain, and unexplained hemorrhaging or bleeding or bruising. So, yan siya. Kaya nga hemorrhagic fever, no? Ang Marburg virus naman is highly virulent kasi nga it can also cause hemorrhagic fever. Ang fatality ni Marburg is 88%. So, how do you get? Usually, the Marburg disease results from prolonged exposure to mines or caves inhabited by bat. So, usually mga bat, no, ang kanang ilahang carrier. So, once an individual is infected with the virus, Marburg can spread through human-to-human transmission via direct contact. Through, ano itong direct contact? Broken skin or mucous membranes. And also through blood, secretions, organs, or other bodily fluids of infected people. And pwede rin siyang sa bedding, clothing na na-contaminate ng fluid. So, hindi lang fomites yun, di ba? So, if the bedding is contaminated with the fluids of a person na mayroong Marburg, pwede yung clothing na yun or yung bedding na yun magiging source of infection for another person. So, that is your Ebola and Marburg viruses. Then we have the Bunya viridae family. So, we have the California encephalitis virus. You get this if you're bitten by a mosquito that has the virus. It can cause febrile illness, rash, and encephalitis. Now, ano yung encephalitis? Encephalitis is a serious condition in which the brain becomes swollen. So, litis, itis. So, naghubag ang brain. And it can be life-threatening, no? So, it can have mild flu-like signs and symptoms like fever or headache, or pwedeng walang symptoms. So, yung sa iba, walang symptoms, yung sa iba naman, severe. And then, this encephalitis can cause confusion, confused thinking. It can cause seizures or problems with movement or with senses such as sight or seeing. So, yun siya ang ating tatandaan with but this is not here, no? Kasi nga, may nalang wala ni sa tuwa. But the virus is not, but the encephalitis, pwede rin siyang caused by other type of microorganism. Then hemorrhagic fever virus. So again, mosquito bite. It causes hemorrhagic fever and hemorrhagic pneumonia. And the hantavirus. So this one, you can get it with close contacts with rodents, inhalation of the rodent aerosols. It can cause pulmonary edema and severe respiratory infection. So ang hantavirus pulmonary syndrome, so yun ang disease, is an infectious disease characterized by flu-like symptoms that can progress rapidly to potentially life-threatening breathing problems. So severe respiratory infection, yun ang ibig sabihin, potentially life-threatening breathing problems. So di ka ginawa ang pasyente. Okay, so they are carried by several types of rodents, particularly deer, mouse. So you become infected by breathing the air infected with the hantavirus that are shed in rodent urine and droppings. So inhalation pa rin ng rodent urine and droppings. Okay, so that's your Bunya viridae. The next family is the Retroviridae. So ito siya ang human immunovirus or the HIV. So we have HIV, we have types 1 and 2. You will get it from blood, no? Transfusion, pwede. Sexual contact, perinatal, mother to child. And pwede rin siya through the use of needles, no? Mga addicts, no? Na sharing of needles. So ginamit ng isa na may HIV, so yung sunod na gumamit, pwedeng magkaroon ng HIV. Or needle in there was a case wherein the patient got it from nagpa tooth extraction. So and the needle that was used to inject the anesthesia, no? So yun. Meron ding isang case, a nurse, naglinis na siya, parang bedding ng pasyente, inayos na niya, and may pala doon na needle. Hindi niya namalayan yun. So, na-prick niya. Okay. Now, human immunodeficiency virus attacks the cells that help the body fight infection, yung T cells natin, making a person vulnerable to other infections and diseases. So per se, the person do not die from the HIV. It dies from the complications. Now, it is spread by contact with certain bodily fluids of a person with HIV, most commonly during unprotected sex, or through sharing injection drug equipment, as I've mentioned kanina. Now, if left untreated, this HIV can lead to what we call AIDS, acute immunodeficiency syndrome. So, pag hindi mo siya gitreat, wala kang ininom na gamot. So, what we do now is that free yan siya sa government, no? In SPMC, meron tayo mga non-government units na they cater to those patients with HIV infection. Hindi pa siya AIDS, HIV pa lang, meaning meron siya ng virus na HIV, but hindi pa siya nag-progress to AIDS. So taking HIV medicine, we call it antiretroviral therapy. People with HIV can live longer, no? Can live longer and prevent transmitting HIV to their sexual partners if the person is taking the HIV medication. There are effective methods also to prevent getting HIV through sex or drug use, so including pre-exposure, prophylaxis, and post-exposure. Now, ang AIDS nga is the late stage of the HIV infection that occurs when the body's immune system is badly damaged because of the virus. So it will take years before a person with HIV can be a full-blown AIDS patient, provided kung na-diagnose na may HIV positive ka, if you follow the regimen that is given to you and you do all the necessary precautions, you can live longer. Provided na you will not have those opportunistic infections na pwede, kasi it's your immune system that is being attacked. So if the immune system is low, any opportunistic infection can get through, kumbaga. The player, Michael Johnson, I think it's Michael Johnson, HIV positive yan siya, but I think he's still alive until now, no? So, kasi nga, with the medications. Okay. Now, kung ang person do not take medicines for HIV, probability they will only live up to 3 years. 3 years lang, no? So, pag nag-inom ka ng medication, gawin mo rin, dapat hindi mo gawin yung mga bawal. Kasi ang uban, they take the medication and they still do yung mga pinagbabawal, it's useless, no? Kailangan, follow mo talaga. So, 3 years lang pag hindi ka nag-inom. So, once someone has a dangerous opportunistic illness, the life expectancy without treatment, 1 taon lang, no? Kasi nga, your immune system is low, so any opportunistic infection that will set in, so pwede na maging 1 year lang. Okay. So HIV medicine can still help people at this stage of HIV infection. It can be life-saving. But people who start ART or your antiretroviral therapy, soon after they get HIV, experience more benefits. That is why HIV testing is so important. It's not really discussed, but I think the number of AIDS cases in the country, in Davao City, has been growing, no? Has been growing. So there are clinics na punta ka lang doon, and then they will test you, and then some people will not expect na positive sila. So may clinic tayo na ganyan dito. Besides SPMC ha, may outside SPMC na ganyan. Tapos they will help you. They will cater for your needs, no? Tutulungan ka naman nila. Okay. So, having that is not the end, no? Kumbaga. And then you have your human T-cell leukemia virus, types 1 and 2. So, this is transmitted through blood, sexual contact, perinatal. It can cause asymptomatic lymphocytic leukemia. Now, ano ito siya? Lymphocytic leukemia is a type of cancer. So in which the bone marrow makes too many lymphocytes or white blood cells. So it is also called CCL, chronic lymphocytic leukemia. So it gets worse slowly. So dili pas-pas, hina iyang progression. And it is the most common types of leukemia in adults. Okay. So what happened in this leukemia is that the spongy tissue inside the bones where blood cells are made. So yun, doon ang cancer, no? Sa blood and bone marrow. So, yun siya ang lymphocytic leukemia. Next is the Reoviridae. So Reoviridae, we have the rotavirus. So this is very common in children, no? So cause of fecal oral route. So from kasi nga, we really need to educate children to wash their hands before, after eating, or anything, lalo na ngayon, no? Kasi if you touch anything and then, di ba, pag bata, iiksubo ka agad. So it can cause gastroenteritis. So, inflammation of the gastrointestinal tract. So, pwedeng magkaroon ng diarrhea. And sometimes, the diarrhea can be severe, no? So, ang rotavirus there is a vaccination against rotavirus for children. Then you have the Colorado tick virus. So the bite of a tick siya. So hemorrhagic disease, meningitis, and encephalitis. Now, yung encephalitis nga is the inflammation of the brain, no? Sabi ko kanina, with flu-like symptoms. Ang hemorrhagic disease naman is a bleeding problem that occurs in a baby during the first few days of life. So iba ito ha, yung hemorrhagic disease. So sa katong hemorrhagic bleeding ng Ebola. So iba yon. So this one, sa baby during the first few days of life. So babies are normally born with low levels of vitamin K. We all know that vitamin K is a clotting factor, no? Factor in blood clotting rather. So deficiency of this vitamin K is the main cause of hemorrhagic disease in newborn. So ito siya pwedeng mag-cause, no? Pag na ano ka. So meningitis naman is the inflammation of the meninges, no, ng brain. So that's the covering. The meninges is the one that covers the brain and the spinal cord. So mag-inflame siya, mag-swell. So yun ang meningitis. Now, injuries, cancer, certain drugs, and other types of infection can also cause meningitis. Then we have your picornaviridae. So, ang picornaviridae nyo naman, under this, you have the rhinoviruses. So, respiratory route, direct contact, secretions, fomites. So, this is the cause of your common cold, your rhinoviruses. So, common cold. Ang fomites, these are inanimate objects that can become contaminated with infectious agents and serve as a mechanism for transfer between hosts. So, they can spread the disease, no? So, they are also called, fomites are also called passive vectors. Passive vectors, ang fomites. Another virus under this family is the poliovirus. So fecal oral route, and it can cause paralytic poliomyelitis. There is a vaccination against this one, your poliovirus. Now, di ba sabi natin kanina, smallpox has been eradicated, no? Wala na yung magka-smallpox. Though the second target of the World Health Organization to eradicate is the poliomyelitis or the polio. The target of WHO was 2020. They made the target before the end of the millennium. So before 2000, nag-target sila. Unfortunately, last year, there was cases of polio sa Philippines pa gyud, no? So you cannot say eradicated siya kung naay cases even in just one country. So dapat wala na gyud siya. So wala nila na natuma ng ilahang kanang projection of 2020 sa poliovirus. So fecal oral route siya. Now, ano itong poliovirus or paralytic poliomyelitis? So if a patient who will have this virus and will not be treated, it can lead to paralysis in the spinal cord and the brain stem or both. So initial symptoms are similar to non-paralytic kasi may non-paralytic polio man. So yung non-paralytic, walang paralysis na nangyari, pero yung sa paralytic meron. So but after a week, more severe symptoms will appear. So pag nagkaroon na ng loss of reflexes, so wala nang reflex yung extremities mo, that is paralytic na. So, di ba makakita mo, like, siguro sa inyong mga kaedad, wala mo makita, but older, meron pang mga cases of, like, kaedad na ako or younger than me, na di ba, yung isang paa niya is maliit kasi nagka-polio. No, muna siya. And meron siya, usually ang makikita natin is sa tiil, no? But I have seen na ang polio niya is one of the arms. So, pwede siya sa arms kasi extremities. But not so common. But I have seen one. So, I asked, naunsa sa polio, pero sa kamot tong iyahan. Okay. So, transmitted siya from person to another by oral contact with secretions or fecal material from infected persons. So, most poliovirus infections cause asymptomatic viral replication that is limited to the alimentary tract. Pero after incubation period of 7 to 10 days, so pwede mag-develop ng signs such as fever, headache, and sore throat. So minor illness, no? Hindi naman lahat na nagkaroon ng polio infection will lead to paralytic poliomyelitis. Only a few lang. So but that is the parabang hindi lahat nagkaroon ng hepatitis viral infection will have hepatocellular carcinoma, yung parang ganun. Then you have your echovirus, fecal oral route then. It can cause febrile illness, carditis, encephalitis, meningitis. So febrile illness is the medical term used to describe a sudden fever or elevation in body temperature. Now, bakit magkakaroon ng sudden increase in the temperature? Now, this happens because the body is invaded by a pathogen and the immune system is activated to fight it off. Kaya if pag may fever, meaning niya your immune system is working and maybe something is wrong. But if kunyari nagka-fever ka after 1 day nawala, pwede na fight off ng immune system mo yung viral or yung any microorganism na nag-infect. So that is your febrile illness. Okay. So carditis is inflammation of the heart, no? Any portion kasi pero mang endocarditis. So endocardium siya. Pag carditis, general. Okay? So encephalitis, na-explain naman natin kanina, pati yung meningitis. Okay. So another, again, the same picornaviridae, you have your Coxsackie virus. So Coxsackie virus, the same fecal oral route, cause of the hand, foot, and mouth disease. Now remember, this hand, foot, and mouth disease is not the same with the foot and mouth disease na maano ninyo sa kanang mga cows, ha? So lahi ni siya. So hand, foot, and mouth disease, what is this? So this is a disease common in children under 5 years old. But anyone can get it. But common lang siya sa mga bata. So the illness is not serious, but contagious. So meaning, we do not need to worry about it, but it can transmit directly. So contagious, dali makatakod. So what happens in this hand, foot, and mouth disease? So magkakaroon ng sores. So the children infected with this one will have sores, which we call ulcers inside or around their mouth. So nandun sa loob ng bunganga, mouth, and a rash or blisters sa kanilang hands, feet, legs, or buttocks. So hand, foot. So sa hand and foot, may mga blisters. Pati doon sa mouth. And although it's not serious, but it's very painful. No? Lalo na yung blisters in the mouth area. Okay. Hepatitis A and E viruses. So this is your fecal oral route. Ang hepatitis B kanina, that was your through blood and sexual contact. This one, fecal oral route. So you can, ingesting food contaminated with the virus can give you this type of infection. So acute hepatitis. So when you say acute, karon lang. So hepatitis, inflammation of the liver. Now, this acute hepatitis is self-limiting. Pwede siyang self-limiting lang or pwede siyang mag-progress into fibrosis or scarring. So, magkaroon ng scar ang liver. And pag nagkaroon ng fibrosis, pwede siyang mag-lead to cirrhosis or liver cancer. So, yun siya. Ang tawag niya, ang complication niya. Okay, so, self-limiting, but it can progress to fibrosis, cirrhosis, or liver cancer. So, ang hepatitis virus, the most common cause of hepatitis in the world, no? Ang kaning A and E, so food ingestion. Now, how can you get this one? So, pwede rin siya, toxic substances. Hepatitis can also be a kanang result of toxic substances. Ano itong mga toxic substances? Alcohol, number 1. So those who love drinking alcohol, that could lead to hepatitis, no? Because your liver works so much to compensate for the alcohol that you take. So muna siya diha. And some drugs also. I think, ano ba yon? I have a student before, the mother, ay yung mama daw is nagkaroon ng, I don't know if it was hepatitis because of a certain drug that she took, no? And sometimes autoimmune diseases can also cause hepatitis. I hope you're still listening, ha, and not sleeping. The room is so quiet. Oh, sinong nagdoodle niyan? Sino yan? Who's writing? Ikapoy na? Kayo nagsulat-sulat na? Sige. Then we have your Tolga viridae family. So your Tolga viridae family is the rubella virus. So this is the cause of your German measles. So German measles is different from the measles, no? Nasa sila difference. Okay. Now, the German measles, also known as rubella, ang iyahang manifestation is red rash on the body. Aside from the rash, people with German measles usually have a fever and swollen lymph nodes. So the infection can spread from person to person. So lalo na pag mga bata, no, madali. If one child has this, and then nasa room, kay nagklase, pwede ma-infect ang mga classmates kung walang vaccination. No? So person-to-person contact through droplets from an infected person's sneeze or cough. You know naman, children. Okay, so that's your measles, no? That's German measles. Yung isang measles, how to differentiate if it is German measles or measles. Ang German measles, yun nga sinabi ko, yung may may rash, no? Red rash on the body and fever, swollen lymph nodes. Pareha lang yapon sa measles, but the only difference is that yung measles, if you see the mouth of the patient na ay measles lang, naa siya white spots. We call it Koplik spots. So that's the way to identify if it is a measles or a German measles. Kaya ang German measles, wala may ingunan to. Okay. Then we have the Western, Eastern, and Venezuelan equine encephalitis viruses. So this can cause encephalitis. So we have discussed this one. So zoonotic siya from animals or insects. So wala. So if you have noticed, ang daming cause, encephalitis is a condition na pwedeng maraming reasons bakit siya magkakaroon ng ganyan, no? So it's not just viruses. At kung virus man, ang daming pwedeng virus na pwedeng maging cause ng encephalitis. Then we have the Flaviviridae. So Flaviviridae, under this we have the yellow fever virus and the dengue virus. So yellow fever, you can get it if you're bitten by a mosquito that carries the virus, and it can cause yellow fever. So bakit yellow fever? So yellow fever is caused by a virus that is spread through mosquito bites. So symptoms takes 3 to 6 days to develop after being bitten. And what are the symptoms? Fever, chills, headache, backache, muscle aches. And 15% of the people who get yellow fever develop serious illness that can lead to bleeding. So that is why magkakaroon ng GIT hemorrhage. It can lead to shock, organ failure, and even death. So yun lang sa yellow fever. Now, we do not have this virus in the Philippines because we do not have the type of mosquito that carries the virus. Meaning, kung wala ang vector, wala po ang virus. Just like the tsetse fly, we do not have it in the Philippines. So that's why nobody gets the Chagas disease or African sleeping sickness. And also this one, yellow fever virus. So kasi wala yung mosquito, specific species that vector niya. Pero sa malaria, naana siya diri sa Philippines, no? Ang Anopheles. Okay, so that is your yellow fever virus. Then we have the dengue. Dengue is also a viral infection that is di na siya mahawa-hawa all throughout the year, no? So any time of the year or kanang peak season niya, kanang ulan-ulan, no? So mosquito bite pa rin. So mosquito, what is the name of the mosquito that can transmit your dengue? Asentista? Yes, unmute yourself. Ano ang ngalan ng mosquito? Anopheles minimus man ang malaria. What about their dengue? Miss Asentista? Oh, who wants to answer?
Aedes aegypti, ma'am.
Okay, Aedes aegypti. Female Aedes aegypti. Just like your female Anopheles minimus. Now, ang Aedes aegypti mosquito, kung dili sila infected ha, and then makapaak sila og kanang person nga naay dengue, so they will get the virus. Now, they have to, kay naa na sila yung virus, they have to bite another host to transmit the virus because mas ano kasi kung dili sila kapaak mamatay sila na I think pila ba ka days or weeks ba to, they will die kasi nakapaak sila og nay dengue. Pag after po nila makapaak og person nya matransmit nila ang dengue, mamatay gyapon sila. So that's your Aedes aegypti. So ingon ana ang ilahang ano sa mga mosquito. So female, I really do not know bakit female kasi ang Anopheles female din, no? So it can cause breakbone fever. Ano yung breakbone fever? So breakbone fever, also known as dengue fever. Pareho lang na sa dengue fever or breakbone fever. So viral illness of sudden onset that follows a benign course. So benign course of headache, fever, severe joint and muscle pain, and swollen glands. And rash. So muna siya, ang iya jud ani is na rashes ang pasyente. Sa una, wala man jud kaayo ng dengue sa una no. If I can remember, seldom ang magka-dengue. The only way is tourniquet test lang siya. Karon even wala kahit tourniquet ang uban mas kinwa pay rash, dengue di ay to siya. So nay mga ingon ana. So dengue can occur in 3 clinical forms. No? So first, sudden onset of fever followed by generalized symptoms and rashes. So then severe because muscle joints. So muna siya. Pain behind the eyes. So most patients recover after a few days. Now, if it goes to the next, so mayroon siyang acute onset, then followed by other symptoms. So thrombocytopenia, kaya nga, di ba, ginakuan kag platelet count. Kasi kung medyo bababa yung platelet mo, doon, magiging ano na tayo niyan, aware, no? Increased vascular permeability and hemorrhagic manifestation. So yun siya, kasi nga nagbaba na yung platelet. And the third clinical form is the dengue shock syndrome. Ito yan siya ang usual reason of death from dengue fever if the disease progresses to dengue shock syndrome. So that is the third stage kumbaga. So what will happen in DSS? Severe hypotension develops, so hypotensive, then hypovolemia. Okay, so yan siya. So 40 to 50% can be fatal, no? But with good enough medical care by experienced physicians and nurses, pwede siya ma-decrease. But usually, ang dengue shock syndrome, half of them are usually fatal because of the hypotension and the hypovolemia that the patient undergoes, no, or feels. So yan siya. Okay. Did I forget something? Okay. Then we have the West Nile virus. So wala gyapon ni sa tua. So zoonosis from birds and mosquitoes, the same, encephalitis. And hepatitis C virus. O, di ba? Si hepatitis A, B, C, D, E, F. Si C is through blood. There was Filipino actor, I think it was Ede Mesa man siguro. Ano lang siya, pierce siya sa iyang ears. And because of that, he contracted hepatitis C infection. Kasi through blood. So it can lead to acute or chronic hepatitis or cirrhosis. Cirrhosis is the the end kanang complication of your hepatitis. So it is the late stage of cirrhosis is a late stage of scarring. Di ba kung ang hepatitis dili nimo i-treat ang inflammation sa liver, it can lead to scarring. So after ang late stage is cirrhosis. Okay, so this is caused by hepatitis and chronic alcoholism. So each time your liver is injured, whether by disease, excessive alcohol consumption, or another cause, it tries to repair itself. Remember that, di ba? Kasi in liver transplant nga, ang imong liver kuhaan lang portion, ihatag sa recipient, no? Pwede siyang Kaya lang, too much, like sobra na gyud na abuso sa liver, muna cirrhosis jud ang labas. Okay. Then we have calciviridae, noroviruses, so gastroenteritis, so very fecal oral route, food or water, so inflammation of the gastrointestinal, mo lang ni siya ang norovirus. And your coronaviridae, so you're very, ang tawag nito? Sikat ngayon, no? Your coronavirus. So under your coronaviridae, may coronavirus, may SARS. So yung coronavirus is the one that is causing the common cold, yung sipon natin. So, and we get it through aerosol respiratory route. And then, it was in early 2000, that SARS came into the picture. So that is your severe acute respiratory syndrome. So mo ni siya which is caused by a coronavirus, no? Atypical pneumonia. What is atypical pneumonia? So infection affecting the lower respiratory tract. So the organism that cause it tend to create less severe symptoms than those in typical pneumonia. If the atypical pneumonia is caused by a bacteria, then it is common to have ear and sinus infection as well. But atypical nga, kumbaga, not the common, no? Not the common type of pneumonia. So, muna siya ang SARS, no? And meron pa rin tayong sa MERS-CoV, Middle East coronavirus. And of course, the very famous nowadays, your SARS-CoV-2 virus. So it can cause upper respiratory tract infection, and this is the cause of your coronavirus disease or your COVID-19. Okay. Later na lang, I will show you, kasi dili na ako this is a Canva, dili na ako siya ma-insert ang video, so I have another later. So dito na ako ipakita sa inyo, that was all about coronavirus from the World Health Organization na video sa YouTube na ako ang nakuha, no? Mas maiman ang manguha ta sa WHO kaysa kita rin maghimo, at least kana sila jud naghimo. So that was the latest that I have nakuha na ako. So later na lang ako ipakita kay maputol na pud ni siya na tawag ani na kaning sa Canva. So it's 2:30, so we will try to finish the last 14. If you see, 14 na lang kabuok. 14. 100 man yun, 14 man yun. Oh, this is your coronavirus. No? So this is the typical. So you have the protein, E protein, S protein, and the M protein. So it is named as corona because mura siya crown. Corona is the Spanish term for crown. No? So why are we able to see this, to picture it like this? Because of the advancement in microscopy, no? Electron microscopy, or meron pang mas higher niyan. Kaya nga, no, nagagawa natin na and through dyes, kaya may magkakaroon ng kulay. Okay. Do you have any question before we go to the next acellular, the prions? Anybody? Yes, Miss Pangulima? You raise your hand. Any question?
Ma'am, pwede po pakiulit nung 3 forms of dengue fever.
Okay. 3 forms of dengue.
Sige po.
Okay, the first is that there is acute febrile illness. So dengue fever, acute febrile illness. So what happens in this form? May sudden onset ng fever, then may generalized symptoms of skin rash, muscle and joint and bone pains. Oh, may pains na. Okay, so yan. And this usually, patients recover from this. Now, pag hindi naka-recover ang patient from this clinical form, it will go to the next, or dengue hemorrhagic fever. So, what happens in this form? So, yung symptoms na na-mention sa first, madugangan siya. Okay? So, what are the symptoms added? Thrombocytopenia. Then, increased vascular permeability and hemorrhagic manifestation or hemorrhaging na. So, that is your second clinical form. Now, the third, kung dili pa yun maayo sa second, ni progress, mo na to siya ang dengue shock syndrome. No? So, in the dengue shock syndrome, you will have severe hypotension and hypovolemia. So, muna siya. And usually, ang fatality is 40 to 50%. Okay? Okay na, Ms. Panglima?
Thank you, ma'am.
Anybody else
Yes
na
po, thank you po.
ano? Okay. So, we'll go to the next cellular entities, your prions. So, prions, bago lang ni siya, no? Ang virus, when prions, I think, just very, very new lang sa micron. Wala na sa una. If you read old microbiology books, you cannot encounter prions. So, these are proteinaceous infectious particles. Kung ang viral particle na more on the genome siya, kasi DNA or RNA, ang prions naman, protein siya in nature. But this protein can infect. Just imagine, no, it's not living kasi protein lang man siya, but it can cause infection. It does not have a virion structure just like your virus or a genome, wala siya. Protein lang yun siya. And also, one of its characteristic is that nganong mahirap siya, lisod siya or walay treatment sa iyaha is that it is resistant to chemical and physical treatment. So, it can resist the use of disinfectants and even heat up to 80 degrees Celsius. Di siya mamatay. Now, your prions will affect neural tissues. Sa neurons man siya, neural tissues. And when these neural tissues are affected, it will lead to transmissible spongiform encephalopathies or your TSE. No? Transmissible spongiform encephalopathies. It can be sporadic, so meaning walay pattern na gina-follow. Minsan sporadic, basta, diri naa, diri wala, diri naa, ana lang. Pwedeng genetic, meaning from the genes, na pass on, na carry, or na-infect lang yun ka. So, ingon ana ang prions, no? Now, ano itong transmissible spongiform encephalopathies? So, this is also known as prion disease, that other name. So, it is a group, kasi encephalopathies man. So, it is a group of rare degenerative brain disorders. So, characterized by tiny holes. So, magkakaroon ng holes in the brain. So, because of that, the brain becomes spongy in appearance. So, characterized by tiny holes that give the brain a spongy appearance. You know what a sponge? Diba ang sponge, if you look at it closely, may mga butas-butas siya. It is not filled. So, ingon ana, the brain is supposed to be intact, pero because of this one na ay mga holes na ang brain. So, muna mahitabo. So, these holes can be seen when the brain tissue is viewed under a microscope. So, kung walay microscope, dili nato siya makitaan, but if we view it under. Okay. Now, the classic example of a disease caused by a prion is your CJD. your Creutzfeldt-Jakob disease or your Kuru. And another one is Kuru, no? Creutzfeldt-Jakob disease. Mo ni siya. So, ang transmission of your prions is contact with infected tissue through transplantation. So, organ transplantation. Ito, very common niya is medical devices. Kani ang among the three, transmission, ingestion, contaminated medical, and transplantation, kani gyud siya ang contaminated medical devices. So this is the most common transmission. Ang transplantation, kay dili man tanan magpa-transplant and maka-afford. So wala kaayo ingestion, not so. Second, ingestion. Third, naning transplantation. So, what is CJD? So, this is a disease transmitted to humans by ingestion of meat from cattle affected by bovine spongiform encephalopathy. So, kani sa cattle, napod sila ingon ani nga sakit, kani siya. So, if ang cattle naa siya sakit na BSE, nga kaunon siya, katong makakaon, magkaroon ng matransmit saya ang prion, so it will have, magkakaroon ng disease na CJD or Creutzfeldt-Jakob disease. Okay. So, what happens to a person na may CJD? So, neurodegenerative disorder siya, characteristic, clinical, and diagnostic features. So, progressive. The disease is rapidly progressive and always fatal. So, when you say always fatal, mamatay ang pasyente. So, infection with this disease leads to death, usually within 1 year or after the onset of illness. So, now, what happens to the person? So, nagkakaroon ng abnormal isoform of cellular glycoprotein, no? Known as the prion protein. So, yan ang mangyayari sa, if you notice, if you look, so this is the brain, so nag-shrink. Kasi nag-deteriorate man ang brain. So, brain shrinkage and deterioration occurs. So, this blue here, dapat ingon anak kadako ang brain. Kaya lang nag-shrink. Now, if we get a tissue of that brain and look at it under the microscope, we will see this one. So, na ay kanang spongiform, this white area here. So, meaning, dapat wala ni siya. No? Wala. Kaya naan naman na siya muna nag-shrink. So, if we look at it without the microscope, so this is the size of a healthy brain. And look at the size of a person with this CJD. No? Ni gamay plus kani, oh. Wala man ni siya dapat. Kana. Oh. So, nag-degenerate ang brain. And usually, people na ma-infect ani, they only have 1 year to live. Tapos mag-deteriorate sila. Mentally, they become, ano na siya, kanang, they cannot think right na, no? Because the brain is no longer functioning well because of this one. So, muna ang mahitabo sa CJD. So, this is the most common type of disease caused by your prions. So, siguro in the next couple of years, na napoy mo gawas nga lain. Because as I've mentioned, prion is not, is not mentioned in the books before. Nawala ni siya. So, you know, science and microbiology is an ever-changing subject, no? So, dynamic yun siya. Okay. So, this is a list of both, ano ni siya, prion and virus, no? So, sa humans ni siya, i-appeal lang sa animals, kaya di na kumakugi, wala lang kugi-cat. So, this is your prion. So, you have the Creutzfeldt-Jakob and the Kuru, no? So, the host, humans, this one, months to years. Incubation, months to years. So, the same. Pareho lang. Ang Kuru, the same lang. The same spongiform encephalopathy ang iyahang presentation. Okay? So, this one is a variant lang siya. Parang strain different lang. So, kani siya nga variant associated with exposure to BSE. Una siya ang ibig sabihin nito. question with the acellular. So we are done with the first, the prokaryotes, eukaryotes, and then acellular. Tapos na tayo sa cellular. Then we have done with the acellular. We go to parasitology. So it's 2:42. At 3 o'clock, we will have a break. So I will try to finish this one until 3. Okay lang sa inyo, ha? 9 slides to go. Okay. Sige. Dali lang, ha? Kay murag nabili na akong belang. Okay, so sorry ha, where is my... Okay, we are now on parasitology. So this is the study of parasites, their hosts, and the relationship between them. So we'll discuss specifically the helminths, the intestinal parasites. Kasi ang daming parasites, so we'll focus on the helminths. And I think we have discussed this in microlaboratory, diba? So the helminths is divided into the 3, nematodes, trematodes, and the cestodes. Okay, nematodes are the roundworms. So round-bodied worms. So round-bodied worms, so we have the roundworms, the pinworms, the hookworms, and the whipworms. So muna ang mga nematodes. Okay. Start with Ascaris lumbricoides. So this is your giant roundworm. This is the most common parasite in humans, especially children, no? Kanang yung bitok, but that is Ascaris lumbricoides. So that is your giant roundworm. What is the transmission? Fecal oral route. So if lalo na pag kunyari a person, dapat kasi ngayon hindi asiguro masyado, but dapat may CR talaga kung saan doon ang mga fecal matter. Kasi if you just throw it anywhere and it goes to the tawag nito with the soil, so and then the soil nagkaroon ng hangin, so the soil is carried out and pwede siya mulan sa imong pagkaon or magunitan nimo ang soil, then you eat that, so you can have the Ascaris lumbricoides infection. Now we'll not go into the cycle because I think I have discussed this one, no? If you still remember, sino ba yung aking dito, microlab? Di ba we discussed the life cycle of Ascaris? Wala na yung naningog, kalimot na sila. Wala, hala, sige. What about, so that is your giant roundworm, Necator americanus. What is the other name for Necator americanus? Your hookworm. Hookworm si Necator americanus. Hala, kalimot na sila. So hookworm siya. Bakit siya pinangalan ng hookworm? Para siyang may hook, di ba? If you try to see the head, the tip of the head of this worm, para siyang may hook. So muangkla siya, mupilit. So that is your hookworm. Then Ancylostoma duodenale. I think this is the old name of your hookworm. Enterobius vermicularis is the pinworm. So pinworm usually infects children. What is the manifestation? Kanang katul ang lubot sa bata. So the only way that you can know if the child has a pinworm infection or Enterobius vermicularis infection, you put a Scotch tape on the anus of the child in the night. And then pagka morning, tanggala siya. If naimupilit dito, nagagmay kaayo na muraog ka ng bitok. So that is because this worm goes out, nocturnal sila, mugawa sila gabi, no? So that's one way to know your pinworm, your Enterobius vermicularis infection in children. And pwede ka nito mag-transmit even sa beddings. Kasi mugawas man siya sa lubot sa bata. And pwede siya muadto sa beddings, pwede matransmit, no? Maka-transmit. Then Trichuris trichura, this is your whipworm. Your Trichinella spiralis? Ano to? Anybody? Nawag tabi. Blando. Miss Blando? Ano ang Trichinella spiralis? Anybody? Blando, you know what is Trichinella spiralis?
Porkworm.
Sino yung nagsagot? Hindi alam sino yung nagsagot?
Vasquez, ma'am.
Pork worm. So this is the worm that is found in the pork. So for those who are very fond of eating pork, beware also because lalo na if the pig, kung saan yung pork meat galing is, tawag nito, sa ano lang, backyard lang, no? So, hindi masyadong malinis ang paligid. Okay. What about Wuchereria bancrofti? Jocelyn, ano ang disease caused by your Wuchereria bancrofti?
Hello, ma'am.
Jocelyn, ano ang disease na ginakos ng Wuchereria bancrofti na worm?
Filariasis.
Okay, filariasis or filaria, lymphatic filaria. So, ano ang manifestation ng taong may filaria? Perez. Miss Perez, ano ang manifestation ng taong may filaria, lymphatic filaria infection? Abigail. Di, o nagwala-ala. Nagkuha mo sa inyong mga kamera, ha? Sigumpan. Kaz, Kathleen.
Ma'am,
How do you know if a person has filaria? By looking at the person. Usually, anong manifestation?
swollen lymph nodes.
Swollen lymph nodes. So, usually, ang kanyang either paa, pwedeng sa paa, yung isang paa niya is malaki talaga, or yung kamay, or sa mga lalaki, pwede ang testicles. Ha? So, there was a case of that filariasis kung saan ang nag-inflame is the testicles of the male. So, if you search mga old microbooks, makita na ninyo sila. Okay. And of course, your Onchocerca volvulus. Ano bang ngalan? May ngalan. What is that? Do you know? That is the cause of your who wants to yes, your may nag-answer, tama 'yon. Sino yun?
River blind.
Okay, river blindness. So all of those are roundworms, no? So dili ta mo go into details because I know sa kadaghan sa micro napatay i-discuss na lahi. Okay. Then we go to the next, your trematodes. Trematodes muna. Trematodes are your flukes, no? So, mga flatworms ni siya, pero they are flukes. Your schistosomes and your Clonorchis sinensis, no? Mo ni siya ang, I have a note for that. That is your trematodes. Sige. So, schistosomes comes in 3 species. Your Japonicum, your Mansoni, and your Hematobium. Okay. So, schistosomes, sige. What is the infective? Dalawa kasi ang ang tawag nito ng schistosomes. Kanyang host, definitive and intermediate. Sino ang intermediate host? Anybody who wants to answer?
Snail.
Freshwater
snail.
Intermediate. Oh. What is the name of the snail, Jericho? Sige,
Kalimot ko, ma'am. Pero
yes,
search na lang ako, ma'am.
Karon, kasi naka-remember. Wala?
Ma'am, katong kuhol,
Okay,
ma'am.
si Octavio Oncomelania quadrasi. That is the name of the snail, the intermediate host of your cystosomes. Who is the definitive host? Sino ang definitive host? Humans. Okay. Anong infective stage ni cystosomes? Infective stage. Anybody can answer.
Ma'am, guess
Infected?
lang, ma'am.
Oh, sige. Unsa man?
Katong cyst.
No? But that,
No.
there is a name for that. Unsa man? Sige. Try to ano be? Wala na? Miracidium. Your miracidium. Okay, that is the infective stage of your kaning. And your ano, is the Cercariae. Cercariae pala, sorry. Bakit kailangan niya ang snail? Because it has to go into the snail because it has to transform into from mother to daughter sporosis. And paglabas nila, Cercariae na siya, may tail na siya, so it can swim in the water. So by that, it can penetrate the host na. Okay? Ang miracidium siya musulod, it will come out as Cercariae. Okay? Tama ba o baka baliktad? Nakalimutan ko. Correct me if I'm wrong, ha? Okay. So you have 3 species, Japonicum, Mansoni, and Hematobium. Still, this infection is common in Mindanao, in Del Norte, no? If there is the presence of the Schistosoma japonicum, if there is the presence of the Oncomelania quadrasi, naag yun yung Schistosoma infection. So, mo ni siya na, dili gyud siya mawala-wala. It's so, and you know, ang kanang Oncomelania quadrasi nga snail, that is very, very small. Mura siya kadako sa butil ng bigas, or smaller than that. So, do not expect na para ng snail na makita ninyo, ha? So, dili na siya. Okay. Then, we have your Clonorchis sinensis. Ano yan siya? And your Fasciola hepatica. That is your?
Liver fluke.
Your liver fluke. Your liver fluke. Okay? Pag the fluke, di ba kasi dalawa kasi ang flatworms, your cestodes and your trematodes. Trematodes is pag sinabing fluke, ang ilahang target is the blood. Blood fluke sila sa blood ilaha. Just like your cystosomes. No? Now, if you do not treat the infection ani nila, it will affect other organs of the body. Your cystosoma, so di ba ang manifestation ani is the person mudako ang tiyan. Why? Ano mudako? Because the liver has enlarged. No, anywhere kung asa ang mudako na organ mo na ang mudako. So sa una nga dili pa kayo ang mga tao mingon dayon nga kuan gidautan or you know I think you have heard those, pero medically it was a schistosoma infection. Okay? Sige. Then we go to the cestodes. So this is your tapeworms, flatworms. Tenea saginata is what? Your anybody? What is Tenea saginata?
Beef tapeworm.
Beef tapeworm. Tenea solium is your? Ano si solium? Kung beef si Tenea, so si saginata, solium is the?
Pork.
Pork tapeworm. Tapeworm siya. Bakit tapeworm? Kasi flat siya. Ang porkworm naman na trichinella, round siya. Ito siya na porkworm, tapeworm is flat. Diphyllobotrium latum, ano siya?
Fish.
Fish? Fish? Unsa man na answer or pangutana? Fish?
Fish.
Okay. Then Echinococcus granulosus. Sa?
Dog,
Dog, di ba na?
dog,
Oh,
wolves,
Dog
foxes.
si ano yon? Si Timothy? Was that Timothy? Nag-answer? Nawala naman. Okay. Sige, so those are just just remember na ang mga worms parasite sila because they have to live in the host and they have to get their nutrients from the host. So, lain-lain ang ilahang ano. Usually, we get it from like kaning uban, like sa isda or whatever. But the roundworms is the one that is causing infestation rather, not infection, infestation in humans. So, ang mga roundworm, pinworm, hookworm, whipworm, muna ang very common sa mga humans. No? Katong sa lahi naman to siya. Okay. Then we go to the, ito siya. So transmission mechanism. Since we discussed the diseases, so transmission mechanism. So how do we get infection? So there are 4 means of transmission. Contact. So contact can be direct. So person to person. Ang indirect, pwede through vector. No? Or na ay another or fomites, that is indirect contact. Droplet transmission. Ay, mali man yung transmission sa airborne. Droplet transmission. So, or airborne transmission, pare-pare lang na sila. So, droplet. Ang droplet, kagaya ng coronavirus ngayon, pag sinabing droplet, kailangan from one person to another person, kung mag-istorya siya, na ay droplets. Ang airborne kasi, from the air that we breathe. So, not necessarily pag airborne, dili kailangan na naadiha ang tao para matransmit ang sakit. By inhaling the air, if the air has the microorganism, pwede matransmit ang droplet from the person to the next person. And of course, food and water contamination. So fecal oral route, so we get it from contaminated food or contaminated water. So from this mechanism, one person can have an infection. Okay. But remember, sino yan? But remember, if you get the microorganism, it does not necessarily mean na magka-infection dayon ka. Why? Because you have to undergo the stages of, not this one. Asa na ba to? You have to undergo the stages pa para magkaroon ng infection. So, dili yun nga pag, except lang if the microorganism is so virulent, no? Kung virulent kaayo ka na. And if the immune system of the host during the infection and during the transmission is very low. So, let us define some terminologies. So, carriers. So, humans are the reservoir for the disease. So, pag carrier, tao na siya. Pag vector, living entities capable of transmitting disease, pwedeng animals or insects. So, pwedeng mosquito, flea, stick, flies, mammals. So, they are all vectors. So, muna sila. Zoonosis naman, an animal disease that can be transmitted to humans. So, muna siya. Zoonotic, meaning, originally sa animals lang siya. But na-transmit sa tao. So, zoonotic infection. This one lang is naay vector, no? Like malaria. So, yan, mosquito. So, yan siya ang mga vectors. Carriers, of course, tao. Stages of infectious disease. So, ito sinasabi ko. So, if you get the bacteria, it's 3 o'clock, but I have 1 minute. What is that? Kindly turn it off. So, first is incubation. So, you get the microorganism. So, it will have an incubation period. The incubation period varies from one microorganism to the other microorganism. Then, the prodromal period. So, diri na siya. After incubation, mugawas na diri ang mga signs and symptoms, no? Mubigin na, prodromal period. And then, muna ni siya ang specific illness. Next to that is, unsa jud ang bation sa pasyente. And after that, na ay recovery. So, the patient can recover. Now, this for pwedeng recovery or death. Kung dili maka-recover, definitely, mamatay ang pasyente. Now, even after recovery, there are infections that will remain latent. Meaning, it will stay in the system for so many years. Or there are infections na maayo makarecover ka, but it becomes chronic. No? So meaning pabalik-balik ang infection. So these are the stages of infectious diseases. I think this is the last slide. So do you have any question? We will have a break. It's 3:01. So do you have any clarification? Wala?
None so far, ma'am.
None so far? Okay, sige. So I will give you a break of how many minutes do you like? 10 lang?
15.
15. Okay. Sige, 15 minutes. So it's 3:02. So please be back at 3:17. Okay? Okay, sige. Sige, let's have a break now. I'll stop sharing now.
Ikaw, yan.
Okay, so it's already 3:17. I'm just checking ha, na ako'y ginatanaw. Wala po siya. Dili na ba mo tanan ko an? Okay. So before we start with the continuation of our discussion, so bago ra gyud I log into my Quipper. So for section A, duha wala nag pretest. The pretest, second pretest. For section B, okay na ni kay nag-appeal man ning duha sa kuan katong ilang daffodil. For section C, duha wala nag pretest 2. And section D, the same person wala nag post test 1, wala nag pretest 2. And I cannot find the name of this person in the participants. No? Section E and F, okay naman. So everybody nag-ano siya. Can you okay? Narinig niyo ba ako kanina?
Yes po.
Okay. So I will not mention the names of these individuals, but I got their names kasi nga sabi ko I log into my Quipper during the break time to see the progress of the ABC. Okay, sige. So yung iba, I don't know. Bakit hindi sila nag-test. So there are 33 ang A, ang B is 30, ang C, ang nakalista sa akin sa B is 31, but 30 lang ang ang naga-quiz. I don't know kisa ng isa. Ang C, 31 sila, duha wala naiduha. Ang D is 30, section E is 31. Ang section F, 32 ang nag-quiz but 36 akong lista. Kasi meron man nag-enroll nga na first year nga basig wa na ako natanggal ilang pangalan. Na-enroll nila ilahang sarili sa ako ang tawag ani kanang subject. Okay? So do you have any clarification before we go to the last topic of our review? I know that you are exhausted. Wala mo. Exhausted ba mo? Wala mo siguro. Summer, exhausted. Summer? Ikaw, Ken na.
Alam ko yung question, ma'am, ba about sa
Sige.
infective stage? Good sa schistosomes, ma'am. Unsa ganito, ma'am? Miracidium ba, ma'am, or
Muna, nakalimot ko kay nakuha na akong brain.
ganyan.
Basta, ang infective stage is katong after na Sir Carrier, infective stage siya sa humans kay mugawas, I think it will come basta paggawas niya dapat sa Oncomelania quadrasi, katong form niya mo ang infective stage to humans, katong na siya tail. Because the tail is used to swim sa fresh water. Tapos pag makapenetrate na siya sa host, ang katong tail, mabili na lang doon siya sa tubig. I think it's the Cercaria. Sige lang, my memory is failing, Chareng.
Ay, ma'am.
Yes.
Another question. Kung sa quiz, good, ma'am.
Ay,
Katong, causative agent sa name ng group. Ano na pag-pronounce group? Kay ang sa table, ma'am, good, ma'am, kaya ang nakita lang namo kay katong
Isa lang man.
Isa lang. So duha man to ka ma'am box. So same lang og content sa box dapat.
Di pa ha?
Duha
First
ka
time
box.
ko na ako
What
maghimo.
the?
Kasi I was thinking
Eh.
na kung duha ang either adto nga duha inyong i-answer, i-correct niya, dili na ingon ana ang sa kuan.
Dili, ma'am, duwa, ma'am. Na-stress
Ma'am,
jud ang
libog-libog.
everyone.
Amo dahil
Ang
because
paper,
I'm
jud, ma'am, lib.
sa tinuod lang, it was my first time. Di ba? Naghimo man, di ba? Naghimo ko sa inyong post-test gabi eh. So, 30 items was so draining. Kay multiple choice ba niya? You know, sa Quipper, maghimo ka every number. Please, lahi na yung manggod yung interface karon mo. Pili pa ka dito. Daghan kay kag i-click before mahuman ang isa ka question. So, dugay kay ko nahuman mo na. Naunsa na orasan ako to na send. Wala na alas 6,
Ay.
alas 7 na. Tapos, ganihan lang ko nag... Ha?
I-double check ni mo to pag kuan sa answers na mo, ma'am, kay sure jud mo
Or
ma'am, baka
bonus,
kasagaran
ma'am.
sa mong answer kay ano, tama
Pila
to
man to
pero
ka
pag abot kay 7 ma'am,
Pila ka buok ang katong duha?
76% may bagsak mi ma'am. Nya kabalo gud mi nga alam mo mo itong answer ba?
Ano na lang, I will get your scores na lang, the raw score. Like for example, 11 ba imong kuha, 12 imong kuha. And then, kaya dili ang akong ginakuha lamang gid is the score. Dili man ko mo base sa percentage kay lahi man ang ato ang computation sa percentage, di ba? 70-30, 60-40 man ta. So dili mag-apply tong sa Quipper. So ang ako jung ginakuha pag mag-quiz is that like 15 items out of that pila imong score. Mo lang jud akong gina-extract yun, ginabutan ako sa akong Excel. So kung katong naay duha ka choices, i-disregard na lang to nako. So dili na siya mo over 15. Ana na lang akong himuon. Okay lang?
So, murag 13 items lang, tanan-tanan, ma'am.
Okay, murag duha man to ang naay duha ka choices no. Ako magong thinking,
Gani,
ang
ma'am.
nako ang duha, either kung mo answer ka aning isa correct, kung mo answer ka aning ikaduha correct, dili na ingon ana ang pagkasabot ni Quipper.
Dili, ma'am.
Kayo,
Emotional mo si Quipper.
Duha, ma'am.
Nag-overthink na ko atong sa group ma'am mo talaga ko nag-search na ko og other name ay unsay kung ang unsay
Bitaw.
other name sa group niya na-search na ko nga bronchiolitis so dato ito na answer ang food ko buang na ni ma'am.
Ingon pa ko unsay naa sa inyo ang ano handouts kato ang sunduga para di na mo maglibog.
Pero,
Mali ko
Katulad-
tricky pag mali ko ba mo tricky day mo hang ano question ka.
Bonus to gani nga pre-test or sa tinud lang.
Gani, ma'am. Pero ano,
kanang
ang duha ka choices, jud, ma'am, kay katumang gud jud ang libog factor, ma'am, Char. Pero lahi ang libog kay Ben. Charot na, ma'am. Dili bitaw, ma'am, kato ang ano, ma'am, murag kabalo man gud mi, ma'am, na nagakuha lang jud ka sa handouts. Kay pag mga
kasi
handouts lang jud na. Tapos wag ko man, ma'am, libog mi nganong duwa siya na isa lang man jud diri. So naga-search mi, naga-overthink mi, ma'am, kay kabalo na biya ka.
Kasi anong duha siya? Kato nga sakit, duha ang probability sa virus na mag-cause adto. Gitan-aw biya na ako
Ma'am,
na
actually, good.
Daghan good, ma'am.
Ma'am,
Oh, ba?
actually ma'am, tulog gud ang main. RSV, ang isa din, ano, katong adreno sa to?
Amaw ba?
Yes, ma'am. Dagan.
Sige.
Kung sa net, i-base, ma'am. Pero ikaw man ang among basis, ma'am, because we worship you. We adore you.
Daring.
Of
Oy, di ba?
course.
Ingon ko,
Ma'am,
Perfect lang
for the-
dami tanan ma'am.
pag ingon ko nga, ako magkuha, diha ra gyud ko magkuha. Kaya nga no, why would I get from other source if I tell you nga di ako magkuha, di ba? It will ano kanang
It will
defeat the
ruin your
purpose, di ba?
So, mo na lang to yung imong
Oh, 13 items na lang. I will disregard the 2 nga na duha ka choices ha. So 13 na lang. So, nya human ningon ko scientific name. Ngano mingon pag yun, i-appeal ang family, ma'am. Si gyud nako ba? Scientific
Ma'am?
name niya, i-appeal ang family, ma'am. Sige daw, be. Unsa ba na? Ay, mas stress ko ninyo, chareng. Di bitaw eh.
Char.
Sige, ay. O wala na laing pangutana sa quiz, kato lang. So, okay na taha. I will disregard the 2 items na, kasi mali po akong understanding sa ano ni Quipper. Lahi po diya ha. So, hindi na lang to nato i-appeal. Okay ra ko adto. 13 na lang. O, i-plus 2. So, kung sa inyong score, plus 2, ana, para over 15 na lang siguro. Ana na lang ha. Sige, ana na
Thank you,
lang.
ma'am.
Oh, kay para di ta maglibog kay pareha ba may dapat og items of quizzes man good. Sige. Okay, no more questions so that we can proceed now. Okay, so I will share na ha my screen. So we go now to antimicrobials. So review lang ni siya, review. Pag sinabing review, you have already discussed this one. So we again view it. Now, I have a kanang notes of, asa na ba yung aking notes? I have a, how many pages notes of antimicrobials? Na dili ni siya mao, I will send it to you. Bahala na mo kung study mo ana or dili, as will send it as a PDF para additional info sa inyo ha. So dili to na ko i-upload diri kay taas kayo to siya, but I think that was more comprehensive than this one. But this is ano na, this is latest no, latest compared sa katong isa na ko na gihimo. So but the problem is murag pangitaon nako asa ang file adto sa akong old siguro na PC. Okay? Sige, sige. Okay, we start. So we are go to antimicrobials kasi nga pharmaceutical microbiology. So antimicrobials against microbes. So it encompasses a lot. So when you say antimicrobials, kasali na ang bacteria, virus, protozoa, helminths, sa lahat ng yan. So antimicrobial agents, meron silang target size on the cell of the microorganism. So this is where they will have their mechanism of actions. So first, they will either target the cell wall synthesis mechanism of the cell so that pag dili na makahimo og cell wall ang bacteria, then it will lyse. So may mga antibiotics tayo na ganyan like your penicillins. Then or pwede rin i-target ng antimicrobial agents ang protein synthesis because if proteins are not synthesized, walang magamit ang bacteria. So it will either target the 30S and the 70S so of the protein na naa sa bacteria. Or the nucleic acid synthesis. So pwede po dito ang action sa antimicrobial. Or the cell membrane function. So either lang ani ang function na ginahimo sa mga antimicrobial agents. So we go to the first anti-tuberculosis drugs. So we will not discuss all the drugs, only the drugs na kanang common ang infection, no? So anti-tuberculosis. So your Mycobacterium tuberculosis. So isoniazid is the first drug of choice. So it is isonicotinic acid hydrazide. That's the complete name of the drug. So ang isoniazid, makita lang natin, is the generic name in the labels of medications. So ang mechanism niya is inhibits the synthesis of the mycolic acid. Why mycolic acid? Because the bacteria causing your tuberculosis is an acid-fast bacteria and part of the cell wall of that acid-fast bacteria is mycolic acid. Wala siyang peptidoglycan. So it's the component of the bacterial cell wall that is being attacked. No, kasi kung walang mycolic acid, magkakaroon ng hindi it will rupture or it will affect the integrity of the cell wall. So yun ang action ng isoniazid. It is the first line drug that we use for TB. So mga non-complicated tuberculosis. Now the adverse effect is peripheral neuropathy. So peripheral neuropathy, so meaning ang mga sa mga nerves, no, minsan neuropathy like atrophy kana maingon ana. So wala na siya ang kanang bantayan na nato, no, sa kanang ani nga mga tawag. I cannot see my notes. Sorry guys. Wala din ako na print. So then the antidote if there is peripheral neuropathy is the use of your pyridoxine or your vitamin. Ano ang pyridoxine? Vitamin B. Ano ang pyridoxine? Vitamin B. B6. B6. Oh. Di ba dapat memorize nyo yan ha? Ano ang B1 to B12? Na siya counterpart na name. Okay, that's your isoniazid. Then next to that is your pyrazinamide. Usually in the drugstore, when you receive a prescription, dili ni siya mao ang ginasulat sa mga naga-prescribe. I don't know why. Ang ibutang nila kablo mo unsa PZA. PZA. So that stands for pyrazinamide. I don't know kinsa nag-abbreviate ana, but if you receive that, that is equivalent to pyrazinamide. So that's the generic. The chemical name is pyrazine carboxamide. So we use this in combination with other agents because resistance develops. So that is the very problem in tuberculosis, no? Dali kayo magkanang develop og resistance. But remember, ang TB is a slow growing microorganism, but it is so hard to kill because of resistance. And ngayon, sabi ko nga yesterday, ang daming multi-drug resistant tuberculosis, MDR-TB. So they do not respond to just plain therapy, combination na. So this is the first line drug for short-term treatment. So when we say short-term, atong 3 months lang, ana. So ang adverse effect, hyperuricemia, so increase in the uric acid and hepatotoxicity. So kaning hepatotoxicity, like, di ba, makabasa man mo sa mga leaflets, ay, it can cause hepatotoxicity, ototoxicity, or nephrotoxicity. May mga talagang ganyan. But we have to understand, if you are the patient, what would you prefer? Matambalan imong TB? Yeah, pero naay possibility na the liver is affected, or dili maunsa ang imong liver, pero dili matambalan imong TB. So we have to weigh the benefit and the risk. If the benefit outweighs the risk, then we go for that therapy. Okay? And it is enzymatically hydrolyzed to pyrazinoic acid. That is the active form upon kanang taking the drug. Okay, so that's your pyrazinamide. Next is your ethambutol. So mechanism of action, inhibit incorporation of mycolic acid in cell wall. So if you notice, they are pareha sila sa PZA, diri sa isoniazid. So ang mycolic acid ang ilang gina-target, no? Kasi mycolic acid is what makes the acid-fast bacteria different from the gram-positive and the gram-negative, and it also add to the integrity of the cell itself. So pag burabag sa tao, the skin is the first line of defense. If the skin is masamad, so pwedeng magkaroon ng infection. So the adverse effect is color blindness. So you cannot identify color, optic neuritis. But this is just, dili man tanan. Or, kaya nga, sabi natin, if the risk is outweighed by the benefit, then we go for the therapy. And rifampicin, or rifampin. So among all the anti-tuberculosis drugs, this is the most active agent. So it is obtained from Streptomyces mediterraneae, but I think today we are producing rifampicin synthetically, no? But before, noon ang mga gamot talagang galing sa fungi. This is a fungi, Streptomyces mediterraneae. So ang daming gamot na nakuha natin sa fungi, cephalosporins and everything. But then with the birth of technology, as long as we can elucidate the structure of the compound, then we can make it inside the laboratory, no? Synthetic na. Because what if wala yung source, yung actual source? So we can produce it synthetically. So the mechanism is it inhibits DNA-dependent RNA polymerase. So RNA polymerase is the enzyme, no? So inhibits the DNA, so dependent. So it's the enzyme that is being targeted. Adverse effect, ito very common, red-orange coloration of body fluids, and this includes your sweat. So if you have a patient taking rifampicin, you have to tell them, ma'am, ang imuhang ihi, mag-orange kaayo. And then, ang imong singot, although dili nimo mapansin, mag-orange na siya. So if you are kanang puti imong sinina, it will magkaroon ng discoloration ang imuhang kanang damit ana. So you have to counsel the patient kay basig makuyawan. Okay? And that is just an adverse effect, no? So we cannot go away with that. That's part of the drug. Okay. So those were your anti-tubercular agents, no? So now, depende sa TB. If the tuberculosis, depende kung unsa kaano sa tuberculosis sa ba ni? gravity of the disease. Kasi na may uban na 3 months lang ang ilahang treatment, na uban, then they will have a laboratory exam, and then pag feeling sa doktor or pag dili paghapon okay, they will be extended to another 3 months, na apoy uban 6 months, but along the course of the treatment, lain-lain na siya. Dili ingon nga idungan na nimo, so naay uban, pwede na ang pasyente, out of those 5 drugs, they begin with 5, then after how many months, kwaon tong isa, 3 na lang or 4 na lang, so naana siya. No? Now, TB drug is free. The problem is that people do not avail. No, sisihon ang government. So, TB drug is really free. You just go to the center, enroll yourself na kay TB, and you will be given full free siya during the full course of treatment. So, muna dapat ang mabalaan sa pasyente. Then we have anti-leprosy drug. So Dapsone. So Dapsone is really the drug of choice for anti-leprosy drug. So ang iyang action inhibits folate synthesis. It is bacteriostatic, so meaning it does not kill the bacteria. Adverse effect includes hemolysis, methemoglobin, increase in hemoglobin, and erythema nodosum leprosum. Class, I will just send you I have notes for this one, just like the ones I have read to you kanina. I was just not able to, kanang print. So di po na ako matunga akong screen nga na siya sa PCAS. But rest assured, I will be sending it after the post quiz. Okay? Sige. Then rifampicin also can be used, no, to treat leprosy, kasi nga the causative agent of leprosy is Mycobacterium ang gihapon. Kaya lang Mycobacterium leprae, but they belong to the same type of bacteria. Then clofazimine, so it's a fenzin dye that binds to DNA. So DNA ang yang target. Meron siyang anti-inflammatory effect, but the adverse effect is red-brown discoloration. Now sa leprosy, ang ano lang is kung ang stage depende no kanang mailhan mo ang kanang mga kamot sa mga lepromatous, no, pero karon we seldom find people with leprosy kasi nga it has been treated. Sabi ko nga di ba kahapon, during the time na pinadala lahat ng may leprosy doon sa Palawan para they will just be in one place and they were treated there para dili na mo daghan ng infection. So because of that mo na karon seldom, no, if kung naa siguro magkapangutana ka asa siya nakakuha, no. Then thalidomide. So thalidomide is for lepromatous kind of leprosy, kato murag advanced stage na. But this drug can cause phocomelia. When you say phocomelia, usually it will only cause phocomelia if the one taking the drug is pregnant and at that time na nag-take siya og tambal. So ang effect niya ana is dito sa fetus. What happens to the fetus? Either walay ang when you say phocomelia, walay extremities. So either walay kamot or walay tiil, no? Now this drug is not originally used for leprosy. So this was a drug in the 1960s that was used as parang for dizziness in anti-nausea, no, sa mga anti-nausea siya. Pero in the studies sa animals, but it was, sabi nila wala talaga daw yun na ano lang kanang napugos lang og release daw ang company, no. Kuan, wala siya effect sa rats na buntis. So binigay nila ngayon sa tao. Now for those people, pregnant women who were able to take the drug, some of them, hindi naman lahat, but some of them gave birth to na sa mga baby na phocomelia. So walang mga, they call it thalidomide babies, walay kamot or walay tiil. So but not everyone. So it took a long time to really prove that the phocomelia was related to the thalidomide. Kaya this is an X. The category of thalidomide is X. So pag X ang category, meaning hindi siya pwede ibigay sa buntis. Diba? You know your drug category ABCDX? Anybody? Kabalo mo sa category sa drug nga ABCDX?
Wala, ma.
Wala mo kabalo?
Obesity.
Kasi 'di ba ang drug is category A. Naana siya sa memes no, or kung A, pag A ang drug like Biogesic, Biogesic is paracetamol, sorry. Paracetamol category A. Meaning safe siya ihatag sa pregnant or whoever. Pag category B, naana siya. So, apila na akong hatag sa inyo. Naana siya category. You should know that because as pharmacists, future pharmacists, you should know the category of drugs. Katong mga ex-good, bawal to siya sa buntis. Okay? No talaga sa buntis. Because it has been proven to cause congenital anomalies. And thalidomide also is now used for myelogenous leukemia. Again, this will be included in the handouts. No? Explain doon. Okay, so yun lang sa tawag nito, leprosy. Then we go to antifungal drugs. So the antifungal drugs are divided, no? So first, we have the synthetic drugs. As I've mentioned, to treat fungal infection is longer than treating bacterial or viral infection, simply because the fungi is made up of eukaryotic cell and we have eukaryotic cell. So mahirap para bang kung ang tambal, kasi pareho ang cell ng fungi and saka humans, so it has to have, para bang dapat makabalo siya asa dito jud ang fungal cell na iyang iatake, no? That should be the case for the drugs. So fatty acids, so we can use fatty acids. So all fatty acids and their salts have fungicidal properties. So we have propionic acid and sodium caprylate. So yan lang. So prepared from, ano na yan siya, kung saan siya source. But among the fatty acids, itong dalawa. We also have andesilenic acid, so from castor oil. So we use it traditionally to treat athlete's foot or your tinea pedis. Then the triacetin, acetic acid, and of course your salicylic acid, di ba? Kanang up is a form of fungal infection. If you notice, di ba, uban mo palit og salicylic acid ka i-apply sa up. Okay? So i-apply sa up. So muna siya kasi meron siyang keratolytic properties, meaning when you say keratolytic, matanggal niya tong layer sa skin, no? Uppermost layer of the skin, keratolytic. Kena nag-raise hand ka? Oh, naman gusto. Sige. Okay. And antiseptic properties, of course. So, next to the fatty acids. So first, antifungal, synthetic tayo, fatty acids. Next is nucleosides and your antimetabolites. So antimetabolites, we use this for cancer, no? So flucytosine. So the mechanism of action is inhibit DNA and RNA synthesis. We use this to treat serious systemic infections of Candida and Cryptococcus. If you remember Candida, and these are bacteria. Candida is a fungal infection that can be opportunistic, no? So flucytosine, and we use this in combination with amphotericin B. Kasi nga serious ang infection, and you know, fungal, matagal siya i-treat, so we need to aggressive, usually when you combine drugs together, aggressive ang approach nato ana sa treatment. Then allylamines, that's the third synthetic. So inhibits the squalene epoxidase. Now, if the squalene epoxidase is inhibited, the result is it will shut down the biosynthesis of ergosterol. Remember, fungal cell have sterol in their cell wall, and the sterol specifically is ergosterol. Okay? So yun ang gina-target niya, no? The ergosterol, the biosynthesis. So we have naftifine, terbinafine, tolnaftate. Ang still available in the market is your terbinafine. I think the brand name is Lamisil. You try to see it if I'm right. Lamisil ang brand. Tolnaftate, Tinactin. The brand is Tinactin. So meron tayo nito sa market. Okay? So remember those na akong gi-mention. Ang naftifine not so common. Kaning duha ang makita na ko sa market. And the fourth one is the azoles. Interacts with the C14 at demethylase to block demethylation of lanosterol to ergosterol. So, kasi ergosterol is the principal sterol of fungal. So, still ang ergosterol yang target, no? So, i-block lang niya ang conversion ni lanosterol to ergosterol. So, if this is blocked, so it disrupts the membrane function and increase the permeability. Meaning, when you say increase permeability, so makapasok na ngayon ang gamot sa loob ng fungal cell. So, example is your ketoconazole. Familiar, di ba? Ano ang brand name ng ketoconazole sa market? Anybody? Wala mo hinailhan ka ng shampoo, ganina siya?
Well,
Ha?
Nizoral.
Yes, Nizoral. Yes. Right, Mr. Ezra. So, Nizoral, that is ketoconazole. No? So, usually 2% lang. Very, very minimal. So, merong cream, Nizoral cream, or Nizoral shampoo. Now, the cream is used for infections, as cutaneous infections, while the shampoo is used for tinea capitis, no, sa scalp, or even ang kanang dandruff, because sabi nila dandruff is a fungal infection. Excuse. So we use the shampoo. Now, if you use this one, it doesn't mean you use it every day. There is an instruction there that I think you use it only twice a week, no? Until mawala na tong viral infection. Okay. Then we have itraconazole, more effective and better tolerated than ketoconazole, and fluconazole. So administered orally and intravenously. So we have the fluconazole is the one that is available as an IV. So usually we use this for cryptococcal meningitis. So Cryptococcus neoformans. So this is the fungal fungi that causes your meningitis, cryptococcal. So remember, meningitis is inflammation of the brain. Now, the brain, meron tayong blood-brain barrier, so we cannot easily penetrate the brain. Kasi nga, meron siyang barrier. So, this fluconazole, meron siyang excellent penetrability into the CSF. Kaya, pwede siyang makapasok doon and can kill the, or can penetrate the fungi that is present. So, drug of choice. And we usually give it as intravenous infection. No, intravenous infection. With this one, I remember, I have a friend na ang iyang brother is, nagsuspect sila na unsa to iyang brother was kanang kuan gani kanang parang dementia ba nga. Dili nakabalo sa mangihi. Feeling niya ang kanang door is the CR na daw. So they gipa check up. And then they found out na may tumor sa brain. So the doctor ingon siya na kanang kuan ipaoperahan. So they had him operated. So brain sa head operation. So natanggal ang katong tumor kasi nga ingon sa doctor if dili matanggal magkaanam og ka progress ang katong iyang degeneration sa brain, and then pagkahuman mamatay gud ang pasyente. So moto ang family nila gipaoperahan. But sad to say that after the operation nagkaroon og infection sa brain, and it was caused by a fungi. So fungal infection sa brain, and because of that mas nadali na noon, namatay na noon to iyang brother og dali. So kaya nga miningon siya, better pa siguro wa daw nila gioperahan kay bahalag mura na siya kanang walay buot na ba kay siya ang brain dako na ang tumor sa brain. Pero katong gioperahan natanggal, but then during the course of the operation nagkaroon ng infection, and it was so sad na fungal infection pag yun. And we know it's so hard to treat a fungal infection. And they cannot trace nga nung nag-ingon adto, no? Kasi nga sa one of the hospitals na maayo man pud sa Davao, siya gioperahan. So, yan. Then voriconazole, so equally effective with Ampho-B in invasive aspergillus naman. And fluconazole resistant candida. Just imagine if fluconazole is excellent na siya, then napa jud candida. So candida is really very hard to treat depende kasi it forms resistant. So pag fluconazole resistant, we cannot use the fluconazole. So we'd rather go with voriconazole, but then it's already kanang combination treatment, no, with amphotericin. Amphotericin B is a old antifungal drug, no? Amphotericin B, griseofulvin, dugin na sila nga mga antifungal, and still they are being used. Kaning uban ang mga bag-o karon, the azoles, no? Then we have posaconazole and ravuconazole. So the same. Now this one, I'm not so familiar with this one katulang because ang uban ani is usually pag nasa hospital setting ginagamit, no? Okay. Then if so ang A nato sa antifungal is synthetic. This one is antibiotics. So we have your polyenes. So binds with the sterol in fungal cell membrane to cause disorganization and loss of the cell constituents. So again, sterol gihapon ang iyang target. So example is your amphotericin B. So this is obtained from Streptomyces nodosus, which is a fungi. Just imagine a fungi giving rise. A fungi itself will give you the drug to kill another fungi. Muna. So systemic fungal infection ang amphotericin B, the drug of choice. Okay. Nystatin, I think you are familiar with nystatin kasi it's in the market. So from Streptomyces norsei, and this is the drug of choice for Candida species, no? Like Candida albicans na mga infection, nystatin. And this is so commonly used, ang nystatin. And natamycin from Streptomyces natalensis gihapon. So ophthalmic suspension for fungal conjunctivitis. So specific siya for fungal conjunctivitis. Then griseofulvin, kato kong gimension, from Penicillium griseofulvum. So it binds with the microtubules within the fungus to disrupt the mitotic spindle and inhibits mitosis. So why mitosis? Because remember, eukaryotic ang inyuhang fungal cell. So it divides by mitosis. So ang mitotic spindle ay ang i-disrupt. So para dili na mag-divide, it will arrest cell division. And usually this is given with fatty food so that ang absorption is increased, no, better absorption. Then echinocandins, so inhibit fungal cell wall synthesis through the inhibition of the enzyme. So the enzyme is B-13D glucan synthase. So you have your caspofungin, micafungin, anidulafungin. So the naming of the drug is pattern according sa iyahang type, no, para dili maglibog pod ang patient ang katong mga naghimo. Okay, so mga candins, so fungin in the end. Okay, so those were your antifungal drugs. Then we go to antivirals. Remember, antivirals do not have there is no treatment for a viral infection. What we can do is to lessen the course of infection, the progression of the infection, but it is really the immune system of the individual that will really help in in ending the viral disease. Now, immunization here. Have you noticed that most of the vaccines that are present in the market are used for viral infection? So, karamihan ng mga vaccines na binibigay natin, hindi naman lahat kasi meron din sa bacteria like BCG, DPT. DPT is diphtheria, pertussis, tetanus. They are bacterial infection. BCG is for TB. But OPV, oral polio vaccine, that's polio is caused by virus. Napay Hib, that's influenza, for influenza, no? So most of the vaccines are for viral infection. So that is what we call immunization. So vaccines are used to prevent most viral diseases. This can include your polio, your rubella or German measles, your mumps, and all those other infections. Now, in order to become effective, they must be sufficiently antigenic to induce an effective antibody response. So, ang ginahatag sa pasyente is the attenuated killed or kanang very kanang it's not the active, no? Or sometimes it is just part, no, ng viral cell, no? Not cell, part lang ng viral particle. So katulang siya ang ihatag sa pasyente. So just enough, no? Enough to create antibody response, because the idea of immunization is that you introduce the body to the disease so that the body will create the specific antibody for that disease. Why is it like that? So that when the real disease comes in, you already have your antibodies to fight the infection. So that's the idea of immunization. So ang ginahatag nato is just para bang stimulus lang so that the body will create antibody. Remember, the vaccine must not cause the disease. It is designated to prevent. Oh. Kaya kung mag-cause siya ng disease, dili na siya, no? Just like the Dengvaxia, di ba? There was issues on Dengvaxia, no? Kasi nga yung mga binigyan, nagkaroon hinunog dengue na matay or nagkaroon ng mga serious complication din namatay. So that was the problem there, no, sa yun ana. So naay wala na tarong, no? So something must be wrong. Okay. So chemoprophylaxis, alternative to active immunization for the prevention of viral infection. So we use this kanang interferes with the steps. So prophylaxis meaning a protection, no? Okay. So we have this adamantanamine. So this is the MOA. So I'm looking at my watch. It's already 4. So just go through lang ako, ha. So this is in prevention and treatment of influenza. So we have amantadine, rimantadine. Simetrel, this is very common in the market, no? Amantadine. Oh. Then we have their neuraminidase inhibitors. So this is the MOA. So please remember, asa siya under, no? Asa siya na under and the MOA. So oseltamivir, zanamivir, and peramivir. Then potent cytokines, interferons. We have interferons. Then nucleoside antimetabolites. So this one inhibits the DNA polymerase. So these are the examples of the drugs that inhibits DNA polymerase. And another one is it reverse transcriptase inhibitor. So it inhibits reverse transcriptase. So that's the enzyme that they inhibit. So maupo di siya ang katong mga examples. Then miscellaneous or ribavirin, no, miscellaneous nucleoside antimetabolites. Then you have newer agents for the treatment of HIV. So NNRTIs, muna sa ang bago na agents. So these are the drugs that are used. No, these are the NNRTIs. So muna siya. We use this for HIV infection. As I've mentioned kanina, kailangan ang mga na HIV positive must undergo therapy, no, kay para dili mag-progress ang disease to AIDS. Then na protease inhibitors. So specific siya, ang kaning isa is kani ang ilang i-inhibit ang reverse transcriptase. This one is the protease naman. So depende lang talaga kung unsa. Kaya lang the downside for this one is mag-cause siya ng high dyslipidemia. It will increase the cholesterol and triglycerides of the patient taking the medication. These are the examples of the drugs na HIV protease inhibitors. Then integrase inhibitors and chemokine receptor binders. So yun. And inhibitors of the GP41 fusion activity. So all of these are drugs that are used for the treatment of HIV. Other antiviral agents, so we have this one. Okay. Then antimalarials, so this is the we have chloroquine, quinine, so mefloquine. So lahat ng ito, I think ngayon, di ba, chloroquine before has been used in the COVID-19. Kaya lang, it was withdrawn, no, because of issues. Kasi it is really for malaria and then hindi siya proven talaga. O kung baga, dili dyan nila ma-prove nga related ba yun sa pag-use sa chloroquine ang katong effect sa pasyente. Okay. So we have your aminoquinolines, your chloroquine, your mefloquine. Then we have your primaquine. Not used for prophylaxis, ha? So remember that. Okay. Then fixed combinations. So sulfadoxine and pyrimethamine, atovaquone and proguanil. So Progranil is a prodrug. So it inhibits the dihydrofolate reductase. Then polycyclic antimalarial drugs, your doxycycline. And the new antimalarials, we have fosmidomycin, artemisinin. This is the newest. So artemisinin is coming from the natural product, natural product extracted from dry leaves of Artemisia annua. Kaya nga sinat artemisinin. In Chinese, tawag nito, Chinese drug use, this leaves of Artemisia has been used long ago. Dugay na kaayo, no? Kasi nga kung may mag-fever sa ila sa una, kani ilang ginagamit. But later on, it was found out na pwede day siya, the fever that is related to malaria. So artemisinin mo ni siya. So this is the, the tawag ito, the structure. Then drug for trypanosomiasis. So you just can go through. But this one, wala tayo kasing trypanosomiasis in the Philippines, so we don't have this one. Leishmaniasis, okay, this is the drug of choice. So for nematodes, may bendazole, albendazole, diethylcarbamazine, ivermectin, pyrantel palmate, you're familiar with this one, there's combantrin, thiabendazole, praziquantel, niclosamide. So these are the drugs that we use. So depende kung trematode, cestode, or nematode ang infection. Some terminologies, so just go through this one. Anong difference ng sterilization and disinfection? Decontamination and sanitation. Why do you have to do this? Oh, we are using the word decontamination nowadays, no? Mag-decontaminate, mag-sanitize. Then this is your biological safety cabinet. So kasi nga, ano yung class 1, class 2, class 3? No, you have to know this one for your biological products. Okay. Now, as I've promised, this is a video of the coronavirus, which I have gotten from the World Health Organization. So this is 4 minutes. So padiyot lang yun kay guys, it's 4:06. So I will let you listen to this about COVID-19. Okay.
Ma'am, may audio po yan, ma'am.
Yes?
Walang audio, ma'am.
Ay, walang audio, sandali. Tama, no? Nakalimot ko sa giingon ni Sir Danch. Dali lang. Bakit ba? Stop share sa ako, then I will share screen again. Share computer sound. Okay, I forgot. Okay.
In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow, avoiding close contact with those who are unwell, the appropriate use of masks and personal protective equipment, especially in a healthcare setting, washing hands regularly with soap and water or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider. That's a quick look at this emerging infectious disease. Given that this outbreak is evolving rapidly, what's known about this virus can change. Please check the websites below for the most up-to-date information.
Kamute ka, ma'am.
So as I've said, that is the coronavirus, no? So there is still some changes in the knowledge of the coronavirus. Kasi nga every day, so they will discover, like noon they use chloroquine, tapos hindi na naman. So every day, no, it can change kasi nga we still do not know what really the virus is all about. Alam lang natin it is caused by a coronavirus. Okay? So I think that sums up our review on microbiology for today. So I hope that you have been refreshed. Kumbaga, katong mga nalimtan ninyo, you have been reminded about this. No? Kasi this is just a review. So I believe you have already taken this. So gi-refresh lang nato ang inyong mga memory. Kay dali ra biya makalimot, no? No. One sem pa gani, next sem nya kani kay first sem pag i-discuss nya karon kay summer na, unsaon na lang. Okay. So as I mentioned kanina, yung mga hindi naka-exam, naka-quiz, I have already taken note of those who were not able to take. I already tatlo na ang nabigay ko na quiz. Pre-test 1, post-test 1, pre-test 2. Tonight, if I will be able to finish the 30 items, 30 items post-test, then I will send it right away sa inyong Quipper. And you have the whole day tomorrow to answer. Tomorrow until midnight to answer the quiz. Okay? So, dili na ko mag-ano, but siguro it will take me time because I will not be using the exact value na, okay, kuan. But it will take me time to make a kanang multiple choice, no? So, sige lang, basta you just take note of your paper. I will give it anytime from, if not tonight, tomorrow. So, mailang mabala naman na ninyo dito. Okay? So, but if you have any question, clarification, you can ask me, you can text me, or you can message me if na may mga clarification. So that if I really do not know that also, then tayong dalawa will learn it together, diba? So, anak man lang na. So, do you have any questions so far? Wala na? So, mag-stop share sa ko. Stop the recording.